Hi, everybody. This is Linda K. Edwards with New Me, New You. We help to educate, enrich, empower, and inspire. We focus on all personal and business development, and we help people to become better than yesterday and to unlock their potential. We give them information, resources, referrals, and we do outreach as well as spiritual enrichment. We also facilitate in person and virtual events. Today, we're talking about briefly ovarian cancer, endometriosis, and breast implants. And it's all about the awareness of all three. Okay. I also want to make it clear that there is no treatment or diagnosis being done. It's just for awareness purposes only. Before we start, I always like to start off with a prayer. So, Father God, we thank you for this day that you've given us. And I want everything that is said today to resonate with each and every woman out there, to keep them healthy, whole, and to be aware of everything that we need to do for ourselves. In Jesus' name we pray, amen and amen. Now, we're going to start with the basic information about ovarian cancer, okay? Ovarian cancer is a group of diseases that originates in the ovaries or in the related areas of the fallopian tubes and the peritoneum, okay? So women who have two ovaries that are located in the pelvis, one on each side of the uterus, excuse me, the ovaries make female hormones and produce eggs for reproduction. Women have two fallopian tubes that are a pair of long, slender tubes on each side of the uterus. Eggs pass from the ovaries through the fallopian tubes to the uterus. The peritoneum, excuse me, is the tissue lining that covers organs in the abdomen. Okay, so when ovarian cancer is found in its early stages, treatment works best. Ovarian cancer often causes signs and symptoms. So it's important to pay attention to your body and know that what is normal for you. Symptoms may be caused by something other than cancer, though. So the only way to know is to see your doctor, your health provider, or healthcare professional. Some mutations and changes in genes can raise your risk for ovarian cancer. Mutations in the breast cancer susceptibility, today my mouth can't work, genes 1 and 2, okay, are associated with Lynch syndrome, are the most common mutations that raise ovarian cancer risk. So ovarian cancers come in a variety of different tumor types and subtypes. The most common tumor type is, and please forgive me if I don't pronounce it right, but it's adenocarcinoma. And the most common subtype is serous endocarcinoma. I hope I said that right. Most serious is endocarcinomas are high-grade, aggressively growing tumors. Now, what are the risk factors for ovarian cancer? Most women who get ovarian cancer are not at high risk, but several factors may increase a woman's risk. Okay, so what can I do to reduce my risk? There is no way to prevent ovarian cancer, but some things are associated with a lower chance of getting it. What are the symptoms of ovarian cancer? Okay, so the symptoms are, and may, this ovarian cancer may cause the following signs and symptoms. So it's vaginal bleeding, okay, particularly if you are past menopause, or discharge from your vagina that is not normal for you. Pain or pressure in the pelvic area, abdominal or back pain, bloating, feeling full too quickly, or difficulty eating, a change in your bathroom habits, such as more frequent or urgent need to urinate, or constipation. So pay attention to your body and know what is normal for you. If you have unusual vaginal bleeding, see a doctor right away. If you have any of the other signs for 2 weeks or longer and they are not normal for you, see a doctor. They may be caused by something other than cancer, but the only way to know is to see your doctor. As you can see in all of that being said, see your doctor for any abnormalities or any feelings that you may have that is not normal for you. Okay, so that's speaking in regards to ovarian cancer. I'm just briefly going over this so that you can, I can bring awareness to it for those who don't know what it is, have had some type of symptoms, and may, you know, have it. I'm not saying you do, but just to check and to make sure. Okay, it's very important. All right. So the next thing that I'm going to be speaking about is endometriosis. Okay, so now I'm going to get into that. Give me 2 seconds to get that up. And so these are 10 things and 10 facts that every woman should know. Okay, so before I even do that, excuse me, before I even do that, because I'm trying to rush through this, and let me take my time and just tell you what it is. Okay, so endometriosis is a puzzling hormonal and immune disease affecting girls and women from as young as 8 years old through postmenopause. Okay, so it's affecting, of course, in the vaginal area, and it has like somewhat like lesions that are on the, and now help me out here and make sure that I'm saying it right. It's on the, not the ovaries, but
it's the outside of the
the
uterus. So it
outside of the
grows the
uterus.
outside of the
Exactly.
uterus. Yeah.
Thank you. Thank you. So I didn't have it up fast enough, so I had to ask.
That's right.
Okay, so forgive me on that one. But so the information that I have here, I have to go back in to make sure that I'm giving you the symptoms. So the most common symptoms are pain in the lower abdomen before and during periods, usually worse than normal menstrual cramps, pain during or after sexual activity, painful urination, bowel movements during periods, fatigue, infertility, heavy bleeding, other gastrointestinal upsets such as diarrhea, constipation, nausea. And in addition, many women with endometriosis suffer from allergies, chemical sensitivities, frequent yeast infections. But many women with endo also experience a range of immune disorders, including asthma, eczema, and certain autoimmune effects. About 30 to 40% of women with endo, and is a common result of the progression of the disease. So as endometriosis, diagnosis is considered uncertain until proven by laparoscopy, which is a surgical tool that they put inside an incision to locate where it is, and they kind of look at it a little closer than with just looking at it like a sonogram or any other device. So not diagnosing and helping adolescent girls and women with the early symptoms of endometriosis is more likely to doom them to pain in later years. So here I have a wonderful friend of mine that I'm first of all commenting on her for wanting to share her story, and her name is Sonia. So Sonia, if you please share your experience. Thank you so much.
Thank you. Thank you. So yeah, so yes, everything, all those symptoms, I had all those symptoms.
Mm.
So I was diagnosed with endometriosis. Unfortunately, not until I'm trying to figure out what age. It was close to my 30s. So it was whenever I had before I had my firstborn. Also, well, like late 20s. But I mean, ever since, I mean, I had gotten my period when I was 12, so at a young age. And really, like, once that started revving up, it was, I thought was normal pain, right? And it probably was normal, but it was so heightened, and just like extra, like pelvic pain, discomfort, just like different things would be just like, even like going to the bathroom, would be like extra pain. You know what I mean?
Mm.
Um, Longer periods, heavier periods. Um, I also suffered from fibroids on my uterus, so that was like another fun, um, sprinkle on top of there. So those were very painful, obviously, as well. Endometriosis, I knew nothing about, absolutely nothing. Now I look back, and even like after I was diagnosed, like there was a lot of symptoms and a lot of things that I was just kind of like, oh, this is normal, or, maybe, just the luck of the draw. I just got it heavier, not realizing like like something more was wrong. Not until um, I ended up having very heavy periods and passing very large, alarming clots. And again, I was really probably seeing the wrong doctor at the time. I remember her telling me like, "Oh, that's just normal. You're on birth control. That's what happens." But I knew better. Like there was something worse going on, and my periods were lasting a long time. Like out of the month, I swear, I think I had my period more than I did not in a month. Like it was just crazy. Um, to the point that I ended up having to rush to the hospital because I had lost a lot of blood. And they couldn't do anything to me until I had 4 blood transfusions.
Wow.
And then and this is still, have no clue I have endometriosis. And um, again, I will really say, like, it, the doctor that I had was just not correct, because I went to the doctor with, they were going to do surgery to like see why I was bleeding so much. And still no mention of endometriosis. And the doctor made me sign paperwork as I'm in the hospital, as I'm getting 4 blood transfusions, as I'm like scared out of my mind. She made me sign paperwork that said, if we can't stop the bleeding, we're going to give you a hysterectomy. At this point, I had no children. That's all I ever wanted, was children. So no children at this point. Um, Late 20s, not even like mid to late 20s. And I didn't know. And what was I going to do at that point? Say I need a second opinion while I'm in the hospital? Like at this point, they were like, you lost so much blood. So really, first and foremost, before I go on with my story, my point of adding this in is to say, if you feel like something's wrong, like don't just sit back. And even if you feel the slightest thing, like change doctors, go ask for a second opinion, because I knew something was wrong. But I think like the fear of thinking something was, and just was like, all right, I'm just gonna go along with it. Sure, whatever you want, I'll stick with the appointments. And then I got to this like heightened sense that I was like in a hospital signing these papers to say like, okay, take everything out if you can't stop the bleeding. So they did the surgery. Thank goodness I didn't have to have anything taken out. Still no mention of endometriosis. After that, kind of being shooken up by that doctor's appointment, and what they did, that surgery was take out fibroids, but still no mention of anything else. I switched doctors to a very good, reputable. God bless this man. He's just amazing. I should have went to him from the start, but I went to him and I gave him all my symptoms. Um, you can't diagnose, like you said, you can't diagnose endometriosis unless it's through laparoscopic procedure. Um, he scheduled that, and he said to me before he even did that, he said, I think that's what you have. He goes, I'm going to bet on it. He goes, but I can't believe you almost signed those papers, or you signed those papers. He
Mm.
goes, absolutely not. So we did the surgery, three little X's on my belly. He went in there, and sure enough, that's what it was. Diagnosed me with endometriosis. While he was in there, he cleaned up all the scar tissue that had gotten really out of control, which looking back at it makes me laugh because I'm like, if you were in there taking out fibroids in that area, you would have seen all this scar tissue that this other doctor saw. Um, Cleaned it up, and got me basically brand new and was like, if you're going to try to have children, you need to do it now. Like now's the time because it's going to grow back. Especially with like what he saw, he knew that it was going to start up, heavy again. Um, I thankfully, all, all thanks to the big man upstairs, but I have two lovely boys. And
Yes.
with endometriosis, it's usually, infertility is a big thing. And make no mistake, it took very long to have these children. It took like 4 or 5 years. That's a whole nother story for another one. Really long to have them, but it happened, and thank goodness, thank God every day for that. But endometriosis is a tough one to live with, and I like it's funny because now that I'm like a restaurant manager and I work around really younger people than I am, at least 20 years younger. And, I don't know if it's like with the generation and nobody's thinking about having kids now. And I'm like, time's ticking. Like, if you want kids, time's ticking. I'm always so terrified because in my head, I'm like, oh my God, you don't understand. Like, time really is ticking. And you never know until you start trying that, God forbid, you have all these other problems that nobody brings light to. Um, and I had a girl that I worked with who actually was telling me, just one day, like, oh, my periods are so painful. And then she's telling me symptom after symptom after symptom. And I'm like, girl, you're me 20 years ago, like,
Mm.
hold on a minute. And I told her, and she never heard of the word endometriosis, never heard of the word. And then, other people, what are you guys talking about? I say the word again. Nobody knows this word. And it's such a shame because I think it's more common than anybody really knows. And it's really hard to diagnose. Like, it's almost like you have to bring it to your doctor and question it and say, here are these symptoms that I'm having. Do you think it could be this? Or because a sonogram's not going to find it, or normal pap isn't going to find it. No normal things are going to find it. um so yeah, it's a tough one. I wish that one was a little more, hopefully this brings kind of, anybody listening that kind of has like a weird symptoms, because it can't be all chalked up to just like, oh, it's normal period cramps or
Right.
normal woman pain, because it really is so much more than that.
Yeah, I actually commend you, first of all, for sharing your story. I appreciate you for sharing your story because you're helping other people and letting them understand that this is very important. This is something that we as women have to learn how to, really take care of ourselves and check on
Yeah,
ourselves. And if there's a something different that you feel, go with your intuition and just go check it out, because
yeah,
even if you think it's nothing, it may not be nothing, but just in case, we must pay attention to our bodies, because our bodies do talk to us. It does tell us, not vocally, but in pain and in a feeling. And so
yeah,
it is very important. And I thank you for sharing that and letting people understand that, if you feel something different with your body, if you feel that, hey, listen, I normally, don't have these like really excruciating pains, when I'm having my menstrual cycle, but all of a sudden I feel like, it's like taking my whole stomach out. Go to
yeah.
the doctor. This is very important. It's very serious. I know someone else that had this painful periods, and it took her a while. She ended up having fibroids, and
Yeah.
she had to get the whole hysterectomy thing. So it's
Oh,
like, and thank God she have children already, but still, like you said, there'll be one person that may not be that lucky and have to result to not being able to do that. And I'm grateful that you have those two beautiful boys,
oh.
and that they are the joy and apple of your eye, and everyone else
Yeah,
knows them. And it's amazing to know that God creates such beautiful, children and things, in our life to keep us happy, but
yeah.
for you guys out there that would like children and maybe having some type of symptoms, or even just to be checked, really, just to get
Yeah.
GYN care is so important because that's our womb care. That's our, where life comes from. So women out there, that's why I'm doing this today, just to touch on a few of these things because these are so important to look into. I'm not trying to get you paranoid. I don't want you to be, like, oh my
No,
God, I
no.
need to go check now. But just be mindful that these things can occur if you don't get the right treatment, if you don't go for your appointment visits and stuff like that, you know. But Sonia, is there anything else that you would like to recommend to anyone or to give them any words of encouragement or wisdom?
I just think like you said, like not to scare anybody at all, but always like never lose faith, never lose hope. Like don't, textbook you read the textbook definition or the Google WebMD definition, it's doomsday. You read it and it's like, oh, infertility and that, no kids for you, or you're always going to be in pain the rest of your life. Like that's not the case. And I mean, I maybe for people, but like just don't give up faith, don't give up hope, second opinions, do your research, take care of yourself because I think there's always, I don't think everything's an end all be all.
Exactly. Exactly. Especially if you look into it early enough,
Yes.
like, I love the way you said that, but it's because it doesn't have to be the end,
Right.
especially if you are mindful of taking care of yourself and looking into yourself, like going to the doctor. But what I was going to say too is each symptom is different for everybody. Some people
Hmm.
might not have the pains, they might have something else, the constipation, they might have, it all
Hmm.
depends on the individual, but still in all, still go get checked because this is what this is
Hmm.
all really about, is for you to have the awareness, but also to go and get checked. It's very, 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 very important. So there's one more thing that I would like to touch on, and this is something that there's nothing wrong with it. This is something that a lot of women go and get done because it helps to uplift their enthusiasm, their you know
Self-esteem, maybe.
self-esteem. There you go, that's what I was looking for. Thank you. Self-esteem. And so this is breast implants. And I mean, I know there's some women, they're like, oh, I wish I had a bigger cup size, or some women want to downgrade and get a lower breast size. But
Hmm.
either way, it's all just to help with self-esteem and to make you feel good about yourself. But there are also some complications and things that you don't know about. But I'm gonna go over just a overview really quickly on that. So breast implants are prostheses of artificial devices for plastic surgery to enlarge breasts for the enhancements of an individual's personality. For a successful conclusion of the surgery and the best outcomes, an individual must have sound physical and mental health. In addition, they must also have realistic expectations. Okay, so breast implants contain sterile salt water or silicone gel. These implants are performed by experienced plastic surgeons after breast cancer, which may lead to the loss of breasts. If you undergo breast implants after the loss of a breast due to cancer, the process is called breast reconstruction. On the other hand, breast implants for increasing the size of the breast are just called a boob job. Okay. So that's basically, what it is. So who can have breast implants? Okay, so while the decision to undergo a breast implant can be a personal one, it can empower you. Before going for breast implants, you must have the following: realistic expectations, good physical health, total development for undergoing breast implant. And then these are the types of breast implants. Okay. There's so many, I mean, over the years that have come out, they've come out with so many different structures and different things. But here they are. So depending on the requirements of individuals, breast implants can be of different types. These include the ones given below. So here it is. You have the saline breast implants, structured saline breast implants, silicone breast implants. Now watch this, gummy bear breast implants. That's something new. Round
Oh.
breast implants, smooth breast implants, and textured breast implants. So many options, right? So, what are the reasons of why people want to get breast implants? As we already obviously know. Okay, so restoring the size of your breast to its previous size, or to correct the asymmetrical breast size, restoration of the size of the breast after breast removal or a mastectomy. I cannot speak today. Gender affirmation, as we already know what that is. Okay, so breast implants versus breast augmentation, right? So the difference of the two, okay? So most female individuals live under the impression that both uh, beat implants and breast augmentation are the same, but some differences draw a line of distinction between them. So a breast augmentation is a surgical procedure to increase the size of the breast. It is a perfect thing for female individuals who have small breasts. On the other hand, breast implants are man made medical devices that are inserted into the breasts. Both are useful in distinctive ways. Okay, so while a breast augmentation is primarily the procedure for enlarging breasts, breast implants are man made devices with silicone shells. The silicone shells are either with silicone gel or saline solution. Breast implants support breast augmentation. So, like, if I wanted to, because I am a busty young lady, but I think it goes with my size because I'm a a full figured woman. So, say if I wanted to like decrease the size, then I would be getting the breast augmentation, right? So, what is the duration and for which breast implants remain intact, right? So typically implants remain intact for 10 years. That's not bad. Not 10 years is a good length of time. However, your experience of undergoing these implants may be different from that of other individuals. In the run, especially after 10 years, your breast implants are more likely to break apart, from movement, from different things that your body may be going through or experience. So this may happen in the form of breast swelling or change in the shape of your breasts or an increase in their firmness. Sometimes a breast implant rupture may happen without any sign. Okay, so here it is. This is the breast implant procedure. What happens before it? This is the before. So before initiating the breast implant procedure, your healthcare procedure will sedate you. They will do it to relieve you of feeling the pain or discomfort during the surgery. When you are asleep following the sedation, your healthcare provider will make an incision to implant your breasts. They will make the following incisions in a way that the scars are not visible. Periareola. This is an incision that is done in the area around the external edge of the areola, okay, which is the big part around the breast area. The inframammary, okay, I said it, yay, I said it right. This form of incision is done on the crease that bisects the bottom of the chest and the breast. The transaxillary, okay, this form of incision is done under the armpit, okay? And then you have the transumbilical. That's, of course, umbilical is by where? Your belly button. So they do an incision. I didn't know that they could do that.
I didn't know that either.
Yeah, that's very impressive. So, each of these incisions has both its advantages and disadvantages. Okay, so your healthcare provider will help you choose the right kind of incision. After the selection, the right incision option, your healthcare provider will place breast implants either between the breast tissue and chest muscles or under the chest muscles and the breast tissue. Okay, so this is Subsequent step following the conclusion of your breast implant procedure. Your healthcare provider will use a compression band to provide support to your breasts. You will no longer need anesthesia for minimizing the pain, and the process of recovery will begin, and you will take some time to recover in the recovery room. Once you wake up, your healthcare provider will monitor your health from time to time. The bodily response during the recovery stage may vary from one individual to the other. You may either feel dazed or have a sore and tight chest. Your healthcare provider will track the condition of your health for several hours. They will keep doing it until the time they feel that it is not necessary. You will need to be careful while going home. It is strongly recommended that you have someone who can drive you home and take care for the first 24 hours following your breast implants. So if you follow the general procedure, you should be able to recover any time between 6 to 8 weeks. So now we're going to do like just brief benefits and risks of breast implants. So the benefits are long lasting, remain intact for 10 years, minimal risks and complications, boost self confidence in skinny women. I don't know, this is what they had there. Risks may lead to long, short term complications like bleeding, don't lift the breasts, may require additional surgeries in cases, and may interfere with breastfeeding for those mothers that breastfeed their children. Okay, so now the advantages, okay? Breast implants provide the following advantages to individuals. Breast implants, again, are long lasting. Typically, they remain intact for about 10 years at least. Okay. Breast implants aren't associated with too many complication or risks. That is to say they are safe. And breast implants play a vital role in boosting the confidence of those who lose their confidence due to small sized breasts. Now, risks of breast implants. Breast implants involve the following risks: complications. Both long term and short term complications may develop due to breast implants. The short term complication of breast implants is bleeding, and whereas its long term complication is hardened implants, so they can become hard. Okay. Breast lift surgery. No doubt breast implants expand the breast, but they do not lift the breasts. For a natural look, you may need breast lift surgery. Additional surgeries. Normal breast implants last for a longer duration, but some women may see its long-term effects. As a result, they may need surgeries related to the removal of scar tissue, repositioning their implant, or even implant removal. Okay, so breastfeeding complications. Breastfeeding, okay, so through breast implants do not create any problems in breastfeeding, but they can affect some women. They may have an issue in producing the milk. Okay, so basically, the conclusion to this is breast implants are artificial or man made devices for restoring the normal size of the breasts or enlarging them, giving that the breast implants are of different types, and each of them has different advantages and advantages. So it is usually best to choose one after proper consultation with your doctor. Not just thinking that you just gonna pick them and then ta-da, this is how it's gonna go. You have to actually go through, analysis with your doctor and talk about, if you're again mentally prepared and physically prepared. You don't just get it done. Okay, so there's nothing wrong with getting breast implants. There's nothing wrong with wanting to enhance your look or anything like that. But just know the advantages and the disadvantages of it, and to just again speak it over with your health professional, or just make sure that you get checked. That's basically it, and make sure that it's right for you, because sometimes we think something is right for us and it turns out that it isn't. So,
Mm-hmm.
and also be happy with yourself. Not saying that it's wrong to do, this procedure, but just be happy with what God gave you, because if he wanted you to have big boobies, he would give you big boobies. If he gave you some really cute, petite, wonderful ones, then he gave you those for a reason. But again, there's nothing wrong with you wanting to enhance anything, or what have you, but just get checked, make sure that it is something for you. Okay. With that said, I thank you so much for joining this today, and I wanted to ask Sonia, is there anything that you have questions on or you want to say about any of the above?
No, no. Actually learned a lot.
Hey, and you
Thank
guys
you.
have to give me for my speech today, because sometimes when you know the pronunciation of a word, it is sometimes you still like fumble a little bit. But all in all, I just hope that this was helpful to anyone out there that is paying attention to this video, because it is very important. All of the above, ovarian cancer, endometriosis, and also breast, implants. Okay. So, with that said, you guys stay great and look forward to seeing you soon.
Thank
Thank you,
you.
Sonia, for joining.
Thank you for having us.
Have an awesome night, guys.